You are about to see a group of 6 professional men who will be meeting for the first time. These men are currently involved in different stages of voice therapy for treatment of the condition known as contact granuloma. As Chief of Speech Pathology Services at Lenox Hill Hospital Center for Communication Disorders, I have been working with a large number of patients with contact granuloma. With this presentation, we hope to encourage speech pathologists and laryngologists to consider voice therapy as a primary consideration in the treatment of contact granuloma of the vocal folds. Contact granuloma is an infrequent problem. It is a unilateral or bilateral lesion located at or near the tip of the vocal process of the arytenoid cartilage. The disorder causes such symptoms as pain, foreign body sensation, bleeding, and possible hoarseness. Contact granuloma results from the trauma that is the forceful meeting of the vocal process of the arytenoid cartilage, which initially causes an ulcerative lesion. Later, excessive granulation tissue and eventually fibrous tissue may form. It is because of the abusive manner in which the patient uses his vocal folds that he inflicts trauma. Another cause of contact granuloma is produced by the irritation of an intubation tube inserted during surgery with general anesthesia. However, in this group of patients, we are dealing with contact granuloma as an end result of trauma related to stress during speech. Although it is a rare condition, when it does occur, it usually occurs among middle-aged men who are by nature perfectionistic, hard-driving, compulsive, and highly self-demanding. By profession, these men are usually leaders in their career fields and are heavily dependent upon daily use of their voice. Historically, this condition was surgically treated by otolaryngologists who removed the growth. Other forms of treatment have included complete voice rest, cortisone injection, zinc treatments, or even the extreme prescription of changing one's occupation. Of all these methods, surgery was the most immediately successful. However, these lesions have a strong tendency to recur and therefore may require repeated surgical intervention. There may be a situation where surgery is indicated, particularly where there is a question of doubt as to pathology or if the lesion is so great as to obstruct the airway. The important aspect to be remembered here is that while surgery can be successful for the immediate problem, it is primarily symptom treatment and does not alleviate the underlying cause. Now that you are acquainted with this disorder, we ask you to observe this group of professional men randomly selected who are currently receiving treatment at the Center for Communication Disorders at Lenox Hill Hospital. Do you use your voice professionally?
Yes, I do.
What is it that is important about the professional use of your voice?
Decision-making, persuasiveness, and dealing with employees.
So it's an integral part of what you do?
Absolutely.
I see. Would you tell me a little bit about what were the first symptoms that led you to the doctor?
Well, in March of 1980, I developed a hoarseness such as you hear now. And I went to my internist, who sent me to an eye, ear, nose doctor. He had first wanted to send me to New York, but we decided to go to a local man. The local doctor put me on voice rest for 2 weeks. But at the end of 2 weeks, the polyp that he discovered was still on my vocal cord, and he decided it was too large to stay, and he had me come in and remove it in the hospital. My voice immediately returned, and everything was normal again for about 2.5 months. At the end of 2.5 months, the hoarseness reappeared. Then decided that maybe I should go to another doctor. I did. He removed it surgically again, and again my voice returned to normal. And approximately 3 months later, the hoarseness reappeared. At that time, my internist and I decided that we were going to the wrong people, and he sent me to voice therapy.
And do you have any idea about the size of the granuloma that you have?
Well, I went through that TV Machida, and it was pretty large. I'm told it's the size of a lima bean, which is huge compared to others that have been seen.
Was there a particular factor that you thought triggered the onset of the granuloma?
Well, I understand stress has an important part in these granulomas. And what happened in March, February, so I was working on a business arrangement with property in Florida, and there was a lot of stress and a lot of tension that may have led to it. There are the normal stresses, though, that an accountant has, and I have all those stresses, as most accountants do.
How has this affected your lifestyle?
Well, I can't function, I can't communicate properly, and my persuasiveness, which is very important in my job, is diminished by this. In fact, I give up. If I just can't get across, I stop. And it does have a factor.
And now this is the recurrence of now the third granuloma, is it?
This is the third, yes.
And each one was quite large.
Yeah.
I do a lot of selling, and I do a lot of speaking meetings and trade conventions, and I go to a lot of cocktail parties. In about October of 1979, I was at a convention, as a matter of fact, and I noticed that I got a sharp pain in my throat when I laughed suddenly, or I grunted, or made any unusual sound with my voice. And I didn't think too much of it. I thought it was a sore throat, pretty much, and I let it sort of drift for the next couple of months, figuring it would go away. It did not go away, and I guess about February of 1980, I went to my internist and said, I've got this sore throat and it doesn't seem to go away. And he treated it, and it still didn't go away. So he recommended that I go to a...
How did he treat it?
Well, he told me to take aspirin, and he gave me a little green pill, which made me urinate about every 15 minutes, and until such time that I thought my prostate had gone. He said I had a polyp, and that it didn't look malignant or anything, and there was no great urgency to removing it, but he suggested that it be surgically removed, and I made an appointment to have it done about 6 weeks after the time I saw him. About 10 days before the time I was supposed to go into the hospital, I went to another doctor who had removed my daughter's tonsils and thought I ought to get a second opinion. And he looked at it, and he immediately said, no polyp, contact granuloma, and I recommend voice therapy at Lenox Hill Hospital. I was concerned as to what it might be, and obviously cancer goes to your mind immediately. I was not a heavy smoker. I smoked an occasional cigar, but I did have a lot of bad habits as far as abusing my voice was concerned, in terms of the conventions and cocktail parties and the kind of selling that I do and have done over the years. Well, I think it affects me, but I think I'm more conscious of what I'm doing. I think the therapy has made me more aware of my behavior and my reactions to stress. So while I can't say that I'm under any less stress, I think I'm more aware of it, and by being more aware of it, I think I'm more able to cope with it. And I think the things that you have taught me to be aware of, and the hints that you have given me have helped me quite a bit.
How important is your voice to you professionally?
Totally essential.
Totally essential.
Sine qua non.
And that's because you use your voice?
At the present time, I'm lecturing. I've given up the chairmanships and the directorships.
And would you tell me what were the first symptoms that led you to the doctor?
About 4 or 5 years ago, I noticed the occasional sore throat, especially after a seminar or a session with graduate students. And I went to a series of otolaryngologists.
A series?
Yes, I became skilled at evaluating otolaryngologists. I had gone to so many. I could detect who had good technique and who used the latest methods, because I'd gone to so many. and none of them detected anything. One prescribed ice cream, which really didn't solve too much of a problem, and I went through all the Cillins because I frequently had sore throats, or my
All the
throat
antibiotics.
was irritated, yes.
Were you placed on voice rest?
One doctor recommended that I not speak for 10 days, and I did that, and still had sore throat when I went back to him. But no one detected a granuloma.
Did anyone suggest that you change your occupation?
No, no one suggested that, but they did recommend all kinds of suggestions as to not speaking, or no one suggested modifying the way I spoke.
Your first impression of therapy was
The best thing I had ever heard, because it solved all my problems. It eliminated the surgery, and it gave me a way of correcting it. So I was...
How important is your voice to you?
Well, it's very important. Obviously, I have to use it when I go to auditions, and I use it in my job a lot because I spend a lot of time talking on the phone or dealing with customers face-to-face.
Then you would say that your voice is very much a part of your profession.
Very much.
That, in a sense, you use your voice professionally. Your profession is your voice.
Right.
Good. Okay. Would you tell me a little bit about what were the first symptoms that led you to the doctor?
Well, it was on August 23rd, exactly. I was walking down the street about 1:30 in the afternoon, and I started to sing. And I sang about 3 notes, and suddenly my throat just went like I was being strangled. And this kept on for about a week. Finally, I went to my internist. He said, "I think you have a minor throat infection," and prescribed ampicillin, which I took, I believe, for about 10 days. Finally, one day, I was discussing it with a friend, and he recommended I come over here to Lenox Hill, where they ran a series of tests on me one afternoon, and they did, I believe, what they call a machitogram, something like that, and that's where they saw it. I saw it myself on the TV screen. It's very, very tiny, but it's there.
And what treatment did your otolaryngologist, the last one that you saw, recommend?
Well, I'm a speech therapist, and I've been working on my breathing, and I'm starting to put the voice into it now.
What was your first impression about being referred for voice therapy?
I was very skeptical about it because I couldn't see how doing a series of vocal exercises, you know, could get rid of a tiny little nodule in my throat. I didn't see how that could work. I have improved somewhat. I believe it is still there, but I am better than I was. Seems to be working.
A tiny nodule, you mean a contact?
Contact granuloma.
Right, right. So you were skeptical initially.
Yes.
How long have you been in voice therapy?
It's been about 6 or 7 weeks, I believe.
6 or 7 weeks. And what have the results been in these 6 or 7 weeks?
Well, shortly before Christmas, he said the granuloma was about half the size of what it used to be.
How important is your voice to you?
I would estimate that I am on the phone or in meetings 10 to 12 hours a day, and so it's, without it I have no business.
Then you use your voice professionally.
Constantly. Worse than an actor. I sometimes think I should have been an actor.
Worse than an
I
actor.
only work 3 hours a day.
I see. Would you tell me about the symptoms that you had?
Originally, I had a hoarse throat, and it was diagnosed as throat polyps. I had that confirmed by another doctor, had the polyps removed, but the hoarse throat was still there.
So your symptoms were this? Again.
And later on, I best describe it as a tired voice. By the end of a long session, my voice is very tired. I have to push to use it.
Was there any particular point on the vocal cords that bothered you? Were you able to pinpoint some particular area?
Well, from the feel, you know, I just can point to where I feel it. It's back in the back of the cords or the throat.
But you can point to one particular spot?
I probably can point to one spot.
And how long have you had this problem?
I would say on and off over 10 years. I had periods of ups and downs.
Did you have surgery?
I did. I had the polyps removed.
From the first time?
From the first time. Since then, I've been told, although the surgery, the success of the surgery was somewhat questionable, I've not had any indication that any further surgery was needed.
Did anybody recommend voice rest for you?
Not that I recall.
Was there any thought of you changing your occupation?
Constantly, but that's not just not just because of the speech problem.
Would you say that you have a stressful professional life?
I would say so.
In what way is it stressful?
Well, I care for my clients, and they always are in difficulty, one either good or bad, and you live and die with them. So you're under a stress situation. We all have tremendous deadlines. It's a profession that deadlines never end.
How important is your voice to you? Do you use your voice professionally?
I would say so, yes. Understatement, yes, definitely. Not as much as I used to before, but
use it just as much?
I use it, yes.
How important is it?
Well, I have to be heard. I have to give all of my instructions, obviously.
And you're speaking all day long?
Pretty much, yes.
What were the first symptoms that led you to a doctor?
A pain on the, not pain, a discomfort on the right side, and
a specific?
Cough, yes, an area here, and coughing.
And what happened? How did you first go to a doctor?
I was recommended to go to an ear, nose, and throat man, and spent some time with him. He diagnosed it as a drip coming from the nose down the back of the throat, together with excess use of the voice. But I have a little bit of a problem. I have like a gag reflex, and he could never get down my throat far enough to see.
What did he recommend?
He recommended mist and steam and no ice cream, but
What a shame.
but he was generally concerned, but it didn't help. No, the symptoms have never gone. I still have the not as much discomfort now on the right side of my throat, and the problem is on the left. I don't feel anything on the left at all, only feel something on the right. And
the first surgery was then when?
It was in July of '79, and I was taking some vocal lessons with a voice teacher, and this didn't help at all. And then he recommended that I came to you.
I see. And then you have had the problem since when?
It's about 4 years, 4.5 years.
About 4 years?
Yes, about 4 years.
Do you have any thoughts about what triggered the problem?
I think initially I was the director of the Harkness Ballet School for 11 years, and during the process of that time we went from a very closed scholarship situation to an open school situation. And as I was the director of the school and supposedly the biggest draw in the school, it was left up to me to make the school commercially successful. So that, I think, started the whole thing off.
I mean, it was the stresses?
It was the stress
of all of that.
Plus also to the definite misuse of my voice.
And what was your first reaction when voice therapy was recommended?
Well, I couldn't see how it would differ that much from working with the vocal coach.
And what have you found as a result of voice therapy?
Lots, actually lots. I'm able to, I think, in my work, because I'm using my voice and also too with a piano all the time, I'm able to do the exercises that you give me during the class, so I can actually practice while I'm teaching. I've changed the whole pattern of my teaching. Some people say it's a little bit mysterious now, but I don't raise my voice any louder than I'm talking now. And I have about 70 or 80 kids sometimes to work with in a class. And I've noticed that the quieter you speak, the more they listen.
This is an example of a patient with a very large contact granuloma, which is seen on the lower right-hand corner of the screen. This was taken pre-voice therapy treatment. This picture shows the patient midway in treatment. You see now that the contact granuloma has been reduced to approximately 1/2 of its previous size. This is the third picture of the same patient who once had a contact granuloma. This was in a period of 3 to 4 months, and as you see now, there is no longer evidence of a contact granuloma. In summary, there has been a continued success rate of the greatest number of those patients who have maintained the therapeutic process even after they have completed formal voice therapy. Those patients that have committed themselves to the voice exercise, stress reduction program, and periodic reevaluation have been able to eliminate the growths. Thorough voice evaluation followed by therapy has been recommended as a means of treatment either in conjunction with surgery to prevent recurrence or in lieu of surgery. The important principle here is that if the presence of the granuloma is the end result of a complex pathological process, removal of the tissue would not necessarily affect the underlying pathological process, in spite of any temporary palliation it might offer. Surgical removal may have only temporary value and does not alter the basic etiologic factors. In summary, we believe that there are valid occasions for the use of surgery in arresting or removing existing contact granuloma. However, we strongly subscribe to voice therapy as a highly successful tool in the reduction, elimination, and prevention of contact granuloma.